Good afternoon, everyone, and welcome to today's webinar. I'm Donna Rice, the Chief Operations Officer for Diabetes Sisters. Diabetes Sisters is a member community dedicated to providing support, education, and advocacy for women living with diabetes and those at risk. Our organization offers a variety of educational resources, including monthly virtual peer support groups where women can learn and share their experiences, challenges, and triumphs in managing diabetes. At Diabetes Sisters, we believe in the power of connection and its positive impact on our health and well-being. Today's Expert Series webinar is sponsored by the BI Lilly Alliance, and it focuses on kidney health and diabetes and features two well-known experts, Amy Hess-Fischl and Anne Safran Dalin. Amy is an advanced practice dietitian, a diabetes care and education specialist, and a certified pump trainer. Her work at the University of Chicago is within the Department of Pediatrics and Endocrinology, and she works with people of all ages with diabetes and kidney disease. She has served on numerous state and national committees, is an international speaker, and has authored numerous articles. She has also received the 2022 ADA Outstanding Diabetes Educator of the Year Award. Anne Dalin is currently a Diabetes Sisters Ambassador and a former co-leader of the Diabetes Sisters peer support groups open to women dealing with all aspects of diabetes management. Anne is a kidney transplant recipient and also a member of the National Kidney Foundation Advocacy Committee. Anne is now actively working as a patient advocate and focusing her efforts on reaching out to anyone who is starting their journey with chronic kidney disease, heart disease, and type 2 diabetes. Anne is the 2024 Distinguished Recipient of the National Kidney Foundation's Richard K. Salick Award. This is a National Kidney Foundation's most prestigious award and is presented annually to a member of the Kidney Advocacy Committee who has demonstrated exemplary advocacy work. Anne will share her personal journey, addressing the challenges she faced and the steps she took to be informed and proactive in managing her condition. Amy will share some nutrition and communication tips to help individuals through this difficult time. They both will emphasize the value of diabetes education and peer support, underscoring the importance of proactive management. Please join me in warmly welcoming Amy Hess-Fischl and Anne Dalin.
Thank you so much, Donna.
Thank you, Donna.
In our very short time today, we're going to talk about a lot of things, but again, hopefully we'll be able to answer some burning questions from you as well. So before we start, not that you don't already know this, but I want to just give a quick overview of what is chronic kidney disease, or CKD. Also want to mention, and I'll say it again, that a lot of the information that we have are going to be resources, websites. They will be sent to those who are on the webinar right now, but then they will also be on the website for those to download later. So let's take it away and talk about CKD. So CKD is when the kidneys become damaged over time and just cannot function correctly. And it's affecting everything that they do. It's not going to be able to remove those natural waste products and extra water from the body. It's not going to be able to help make those red blood cells as efficiently, balancing that important minerals in the body, helping maintain your blood pressure and keeping your bones healthy. So again, it is affecting so many things. It also increases the risk of other health problems like heart disease and stroke. So developing CKD is usually a very slow process with very few symptoms at the beginning. And for those with diabetes, we are well aware that blood pressure and glucose management are the cornerstones of reducing that risk and progression of kidney disease. So that means that the person with kidney disease plays a very important role in slowing its progression, as well as being a part of the healthcare team to choose the right plan for you. So to kick this off, Anne, I would love for you to tell everyone about your journey with kidney disease. Would you do that for me, please?
I would love to. And Amy, where were you 20-something years ago when I needed to know that information? My journey didn't.
I was just starting out, again, I should have,
I'm
here's
glad.
what
I'm glad I found you, because my journey started off with diabetes, and I didn't know I had that. It wasn't until I had an eye exam and a doctor said, something doesn't look right. You have diabetes? And I said, no. I had a test and the doctor said, yes, you do. And that's where my journey started. At that point, I had no idea that diabetes was connected to heart disease. I had no idea that it was connected to hypertension. That was something that no one mentioned to me, or to kidney disease, or to every other, you might say, apathy that comes along, whether it's eyes or feet. I didn't know any of that. I had a long educational trip down through all these different things to try to understand what was going on. They were separate, you might say. They were treated as separate issues. After being diagnosed with diabetes, yes, I did wind up with heart disease. And years later, kidney disease. All of these were working quietly in the background. And as you said, they were silent. I had no idea what was happening to my body until I saw what blood tests showed. And then it was like, oh my gosh, I have some things I need to address.
Thank you so much, Anne. While I know this is a loaded question, but what do you think are some of the challenges with kidney disease?
It is a loaded question because there's so much involved. It encompasses everything about you. It's important, as you mentioned, about learning what the kidneys do. National Kidney Foundation had a video that they put out that showed step by step how important the kidneys are to every function in your body, to clearing waste products, red blood cells, everything else. And so it took me a long time to learn about these things. It's important to find out which medications you can take, which ones your doctor says you can't take these anymore now that you've got chronic kidney disease. With CKD, it changes everything. It doesn't have to be difficult, but it needs to be something that you're super aware of. You need to find out at what point would your doctor suggest that you might need dialysis. I was getting ready to go on dialysis because my kidneys were at end-stage renal failure. I was very lucky in that my son became my transplant donor. So thanks to him, I'm going to live a long life with the kidney I made for him. And it's changed my life in that way as well. There are a lot of challenges that we deal with, that we're confronted with, but fortunately, there are answers. There are people we can turn to. There are resources that we can use, such as Diabetes Sisters, such as the National Kidney Foundation. And those are things we should take care of. We also have to learn, how does food affect our health? They're tied together. They're one, and you can't separate them, because everything we eat may affect our bodies differently. So it's important to learn how to cope with all the things that are being, I don't want to say thrown at us, but being presented to us, and do it in such a way that it doesn't cause stress, because that's another thing that can exacerbate kidney disease and diabetes. So there are so many different things that we can go into regarding that.
Oh, no, agreed. And, I know that, as a dietitian, a diabetes care and education specialist, especially when I'm working with someone with diabetes and kidney disease, we know that if they're, the longer that somebody has diabetes, it's likely that they might be taking insulin. And we know that the kidneys don't process things as well. So the insulin could lead to higher risks of hypoglycemia. So, kind of my 1, 2, 3 punch that I like to really talk to individuals and make sure that they have the information on, what is their insulin doing, how to treat hypoglycemia appropriately, and what do we need to do to make adjustments to those insulin doses to reduce the risk of hypo. And, that's where it's so valuable to meet with a dietitian and or a diabetes care and education specialist, because it's about the transition. Again, everything is an ongoing process. So, like you said, all of these challenges kind of fit together. So yeah, again, thank you, Anne. And what were your steps to really coping with everything that was going on?
Coping, that's a big word when it comes to dealing with multiple health issues. Having concerns is completely normal. You're kind of tiptoeing into a place that you may never have been before. This is something that is you have to absorb what's going on without being overwhelmed. And so when it comes to starting your care, bring somebody to your doctor with you. I know that things went right in one ear and out the other, but bringing someone with you, let them take the notes so that when you leave that appointment, you don't have to go, oh no, I don't remember what the doctor said. Some doctors now send you home with a printout of what was discussed. That's what a couple of my doctors do. But my sister said her doctors don't do that at all. So that's another element. Look into support groups. I mentioned Diabetes Sisters, and that's why we're all here today. That's something we've learned that we can rely on. We can get information from them. We can get guidance. We can get materials. National Kidney Foundation is right up there with Diabetes Sisters because that's their focus. They're trying to help people maneuver this to manage their numbers so that progression doesn't come as quickly. And if it does happen, that things get a little bit more difficult to deal with, they're there with answers. So joining a support group like Diabetes Sisters or one that you may find through Facebook, there are some wonderful groups out there that have people that are dealing with what you're dealing with. Also, when it comes to your doctor, don't look at them as somebody that is there for you to listen to. Become a partner with your doctor. Go in with questions because, again, when you go home, if you didn't ask a question while you were there, you might have to wait 3 months to go back. It's not as if our doctors are easily accessible. At what point are you going to consider dialysis? That's another thing that you'll depend on your nephrologist to work with you to figure out what the best treatment is for you. So you'll go through all these different steps, which will help. It'll help remove any of the fear you might have about venturing into this new territory. So, it's a new, like I said, it's a journey. And so you rely on your doctors for help, but make sure you stay involved and go in there as a well-informed patient as well.
No, awesome. And I'm so happy to hear you say that concerns are normal. Because again, I that is something that I like to really highlight to every single patient that I see. And again, I hate the word patient. It's person, person that's sitting in front of me that I'm having a conversation with, that it's normal. Let's take a deep breath and let's kind of tackle some of these things together. And so I really do think that it's important as an advocate for our care that we are the ones that are going to our doctors and saying, again, I have some concerns. What do I do? And that's what I love to have dialogue with the people that I see of, you lay it out. Tell me what your fears are. Let's really have a really honest conversation because, coping is such an integral part of, our quality of life and our success. So I'm so psyched to hear you say that, Anne.
Thank you.
I know that you've said this a couple times, but it doesn't hurt to mention them again. Where can we find support when someone is navigating kidney disease management?
Well, you may have heard of Diabetes Sisters. Oh, yes. Yeah. And as I said, it's become an important part of my life because by managing my blood sugars and managing my diabetes is an integral part of managing my chronic kidney disease. It's those sugar highs on a constant basis that can make the kidney disease progress. We want to try to avoid that for as long as we can. Somebody may be at, let's say, stage 3 kidney failure. It doesn't have to progress to stage 5 as quickly as it might if you haven't been educated through managing your diabetes. So there are all different kinds of things you can do. Go to your hospital. They may have some great support groups. Facebook has some amazing places. You'll see when we share all the materials after that there are resources out there for us that will help us with the management of our kidney disease.
Great. And, I know as a dietitian, I have to ask these, we're going to be talking about them, that meal planning, with kidney disease is one of the most complex patterns that anyone can be asked to do. When speaking with a dietitian, what are some of those key questions that you found that were helpful to ask?
Well, part of my education taught me that someone with early stage chronic kidney disease needs to do something way different from somebody who's advanced to dialysis, and then somebody who's dealt with transplant. So that's where the education and the nutrition comes in. We need to educate ourselves. Otherwise, we're not going to save our bodies if we don't actively get involved in lifestyle changes, in finding out how much should I be drinking during the day? Do I really need a gallon of water a day? I don't think so, and it may not be recommended. Again, find out what works for you when it comes to sodium, when it comes to how much protein we need to eat. We need to make sure that our electrolytes, which include potassium and phosphorus, magnesium, sodium, all these different things are balanced, because again, that helps to possibly slow the progression of what we're dealing with. You want to keep those things at a reasonable level. It's really about progress, not perfection. None of us can be perfect all the time. I don't think so. So it's important to speak with somebody like Amy, or somebody at your hospital, or someone your nephrologist recommends, to see how you can manage all these issues and make life more comfortable for yourself.
Yeah, no, great answer. I know that as a dietitian, when I'm working with someone, I really like to just start small and make realistic adjustments based on that person's needs and their requirements. But we know that meal planning is an ongoing process. And I think that it's really important that people understand that it's not a one and done. Meeting a dietitian for 30 minutes and you're going to get all the information. This is let's do this. Let's see how it goes. How did you do? What other changes that we need to make? And I think that's really the key here, that medical nutrition therapy, nutrition education is something that's ongoing and can certainly, when I think of, first and foremost, we need to, work on sodium first. But, again, I think that it's all about what are you willing to do. So I think it's nice to have that dialogue and ask those questions to the dietitian that you're working with.
Amy, that also brings up the importance of keeping your appointments with your doctors or your nutritionist.
True.
As I said, we're not perfect. We may go off on a direction with our eating that's not very helpful towards managing our health issues. We're all human. It's not as if a diet is suggested to us or a way of eating is suggested to us, and we wake up the next morning and everything is perfect. It doesn't happen that way. It's like a roller coaster. It's a learning experience. So along the way, be as nice to yourself as you are to others in maneuvering all these things that you may never have had to deal with before. And I know people who have avoided doctor visits because they said, I'm not behaving, I'm not doing well. That doesn't matter. What matters is that you keep on top of what you're doing, have your blood tests so you can see where things are for your health.
No, agreed. Progress, not perfection. Again, dietitians aren't perfect. There is no perfect, like you said. Again, I like an honest person. Let's have an honest conversation. And again, let's take perfect out of the equation. So I so agree with you. What are some of the most important questions to ask your healthcare provider about when you have kidney disease?
Well, since it's new territory, you need to find out the way you're feeling. Are these things normal? Are you going to be exhausted all the time? Are you going to have other issues pop up that you don't know if they're related to diabetes and kidney disease? Ask your doctor. They'll be able to guide you through it. You'll want to find out how you can deal with different parts of your lifestyle changes with food. How to be more active when you're not feeling your best. How to just make yourself, or help yourself, I should say, get to a point where you understand what's so important and be able to talk to your doctor, ask questions. And if something doesn't sit right with you, don't leave the office going, I wish he had explained it better. Right there, just say, doctor, I really am not understanding what you're saying. Have them explain it. They're the professionals. Have them explain it to you. So that's something that we need to rely upon the experts to guide us through all of this.
But you're the advocates for your care, and so really that communication is crucial. So I love that. So yeah, I also want to remind everyone, that diabetes education, nutrition education, they're covered benefits for Medicare and most insurances. We know peer support is crucial. So again, I want that in addition. But just to remind you that diabetes education, there's critical times like diagnosis annually, complications, all of those times. So again, you typically 2 hours a year of diabetes education, 2 or more hours of nutrition education. So use those benefits. Get a referral from your doctors to use that, because it's about that ongoing conversation with a diabetes care and education specialist. But like I said, peer support, I cannot say enough about how important it is, because they work together. And you're dealing and talking with people that are going through the same thing as you. And again, as I tell all of my patients, I don't have diabetes. I don't have kidney disease. But again, I can help navigate through some of the intricate details. But I want boots on the ground people that, you have that camaraderie with. So yeah, again, just wanted to plug that. But we have a couple minutes left, so I'd love to see if we have any questions from the audience.
I just want to jump in here and say thank you, thank you, thank you. This was really amazing. Your words and your perspective, and Amy, your thoughts around some of the challenges and tips was really outstanding. And at Diabetes Sisters, we're really building out workshops really that are focused on our members' needs. So I'm really excited and proud that this workshop went so well. So thank you. So just looking at some of our questions, we do have one question that's come from Molly S. in Elmhurst, Illinois. And she says, can you give me a few tips on preventing microalbumin from progressing? I know I have it and I want to be proactive.
Oh, well, Molly, Elmhurst, come on. You're like just down the street from me. So microalbuminuria, yeah, I again say that. I'm sorry. I've been up since like 3 o'clock this morning, so my brain's a little fried, but microalbuminuria. There we go. I can say it. That's having that urine test every year. We know beyond a shadow of a doubt that it's about blood pressure and glucose management. So those are the two most important things that can be done to reduce that progression. Now, there are medicines that can also, that you're talking with your healthcare provider, but when we think of how do we stop that progression, blood pressure, blood sugar.
Great, thanks. And we have another question, and I think this one is for you, Anne, and it's from a Nicole V. And she said, "You are indeed an advocate, and I appreciated your story. Can you give one piece of advice or a tip on what you would tell somebody with severe chronic kidney disease?"
Wow. Just one piece of advice. Be kind to yourself. And see, I'm getting all misty here because it's a life changer. And it doesn't have to be something terrible. It can be something that you can flourish with, you can thrive with. And when we had Reva Greenberg speak a few weeks ago as part of the Diabetes Sisters presentations, it's basically about understanding and loving yourself and giving yourself a chance. And so since you're working on with something that you may never have dealt with before, and you just have to give yourself a break, because stress does not help when you are trying to control your blood sugar numbers. I learned that recently. I went through some very difficult health issues and my blood sugar soared. They went crazy high, and it wasn't from what I was eating. It was from stress. So give yourself some leeway. Understand that you can't always be in control. You can try to manage things the best you can, but just be as kind to yourself as you are to others when you're dealing with any of this. People have told me that many times, and I now take that to heart.
Well said. Well said.
Right. Very good. And then we have one other question, and I believe this would be for you, Amy, and it's from a Karen L. in Dallas. And she said, "Sodium is so difficult to control. Any tips for eating out? I never know what to order."
I know eating out is one of the hardest things for most people, again, and sodium is tricky because, again, when we think of, 3/4 of all processed foods, again, is high in sodium. Eating out is something that when we think of the customer is always right. If you can do so, again, really tell the server what you need. I have a friend of mine that, again, she's like, "I need this on the side, again, like sauces on the side, because that's going to be higher sodium. Make sure that you're having plainer things, fruits, vegetables without a lot of zhuzh on it, because again, it's really the sauces and stuff that's really going to that's going to add to the sodium. The other thing is that when we think of the sodium content, it's again the course of a day. So can you have, much lower sodium items for before you eat out, and then watch those portions of what you're having when you're eating out. But that's, that's always the toughest one for most people. So I hear you.
I'd like to share one tip that's super helpful to me. It was pointed out that, as you said, processed foods contain a ton of sodium. But if you're preparing something at home, or even if you go to the restaurant and say, "I'd like my burger, I'd like my chicken breast prepared without any salt," when it comes to the table, if you sprinkle a little bit of salt on for flavor, you're getting a lot less because your tongue will pick up the taste of the salt. So you're not diminishing what you're eating. It's not making it taste bad because you made an adjustment. And the other thing I found is I use them as my personal chefs, and I am fearless when I say, "Oh, if I'm having a chicken something that comes over pasta, I ask for it to be put over spinach." I have never found a restaurant that won't accommodate me. So if you don't want something, or you want something changed, unless you're at a fast food place, I guess, if you're at a restaurant where they're preparing your food, request whatever you'd like.
No, that's great.
Good points.
Well,
thank you.
Donna, I'm not sure if you noticed, Soon just asked a question of what do we think of a low carb diet is his work.
Yes.
And I was just typing it up that I think any meal plan that someone actually follows is the right one. So I think that there is no one size that fits all. And, again, we want to make sure that we're not eliminating entire food groups, but eating lower carbohydrate, we know has many benefits when it comes to glucose management and, sometimes with weight management. So I'm going to stick with, again, if the meal plan that's right for you is the one that you're going to stick with.
Yay, Amy. Thank you for saying that.
Absolutely. Well, we are just about out of time, and I just, of course, want to extend a huge thank you to both Amy and Anne. You were both like incredible, and really to continue this discussion on kidney disease, we would love for you to join Amy and Anne on May 1st at either 12 noon Eastern Standard Time or 7 p.m. Eastern Standard Time. They will be conducting a peer support workshop for our members focused on kidney disease. To register, please visit our website and go to the calendar of events. It's free of charge, and it's a time to gain knowledge and tips from our speakers and from other women dealing with kidney disease. This program was recorded today and will be made available on demand on our website in the upcoming days. On behalf of the entire Diabetes Sisters team, thank you for joining us and participating in this very important webinar on kidney disease. We look forward to seeing you in our future lifestyle events. Have a wonderful rest of the day.